Great. And if I quote you on anything, of course, I'll run quotes by you before I put them to be published. Okay?
Okay, sounds great.
Excellent. Right, so I sent you those questions from before, and as I said before, they're more of a guidepost for where things go. So that first question of describing the vision behind BeHeard Mile High, I guess I do have a couple more specifics to that. And I'm wondering, like, what were things like before the panel was created? Were there any specific issues that were really being like egregiously overlooked, or were there any incidents or events that really demonstrated the need for something like BeHeard Mile High in the Denver area?
Yeah, so BeHeard Mile High actually was in response to something that the center did back in 2011. So the previous CEO, Grant Jones, he actually had conducted a health status survey on Denver Metro's Black church-going community. And there's really an opportunity for congregations to understand, for pastors and first ladies, for all different church and faith leaders to actually understand a little bit more about their congregation's health status and some of their needs. So when I came back, I believe it was a little over 1,500 to 2,000 responses we've gotten just on that survey back in 2011. And that kind of sparked an idea around like really just us as an organization creating a feedback channel for community to talk about their issues and to talk a little bit about just their experiences. So it's a good way to update the status of different things. A lot of times it's around health focus, but we think also around social determinants of health. And I'll talk a little bit more about that too. But the original survey talked about health status, talked about insurance, talked about barriers and issues. So it's a lot of the same stuff we're talking about now. The social determinants of health is kind of like that buzzword that's used around it, but our surveys are shaped around that to ask in different areas of health and well-being, what's going on in your life, what are your needs, what are your perceptions, behaviors, what are some patterns maybe you recognize as a community member. We get information about where they're calling from as far as geographics, and then also some of their demographics as well. This really just brought an idea of just how do we make sure that we can use community-informed data to create change in the community. So some of that, at the time, actually, the city of Denver conducted a similar survey on community members, just like a community needs assessment. And they had about 400 respondents from that Black or African-American community. So it showed a great disparity as far as, when we were trying to ask community what they need, what is it that exactly is the barrier for us to get that information? And, our current executive director, Deidre Johnson, she likes to say, she says specifically, sometimes to hear a community, you just have to be the right one asking the questions. And that was one thing that 2011 survey helped us learn as an organization was that, that depending on who's asking the questions, we can understand, we can actually reach the audiences because we're a lot more of a trusted source. And when we think about our community, especially when it comes to healthcare systems, there's a lot of mistrust historically and currently, with those systems and also abuse in those systems. So to a lot of community members, it's justified to have that mistrust. And, for us, is really just trying to understand, how can we make sure that we can still have community members navigate through systems of health, that we can help them reach that highest level of health and well-being. With public health, that's all you're trying to do is try to achieve that.
Right. I just want to make sure I heard correctly. So you said the survey that happened in 2011, that was done by a senator? Is that what you said?
Oh, no, by the Center for African American Health.
Oh, okay.
Yeah, but it was done with church audiences. Yeah, there was Grant Jones, and originally the center came out as the Metro Denver Black Church Initiative. So it came out serving communities of faith. So we've always had partnerships and continue to have partnerships with over 70 different churches, which create different network opportunities for us to actually help provide services. There's a lot of churches that are interested about their congregation's health and some of their needs. So that's something we still work with independent churches on. But we use BeHeard's platform and infrastructure to do that. And there's some advocacy projects too, I'll mention later, around what we use BeHeard for. So the infrastructure is nice because it helps us as an organization understand our audience, but also it's a great way to be able to share that information with other organizations to help also advocate for policy changes when it comes to, systems and policies through community organizations, through government, and also, through just private organizations that might have policies that might benefit the community.
Yeah, and I mean, thinking back to those early days, like, were people like surprised that people wanted to hear about their perspective on these things? Like, how did people react to being asked to be surveyed about these these issues?
Yeah, I came onto the team back in 2018, but the survey, when it came to, well, BeHeard was established back in 2017. So I actually joined the team before then, but from my understanding, it was essentially the same that we've always get, which is that whenever there's opportunities for us to ask community through community-based research to ask them what they need, there's always that hesitance at first of just, where's my information going? What use is it? There's a lot of times where, it's a classic thing to say now, unfortunately, that, our community is over-researched and under-delivered a lot of times. Even when it comes to just communicating results, it's something that a lot of times we don't even get follow-up on. So that's something that we're trying to change. We've done a lot of data collection and partnerships, but at least at the time, from my understanding, it was just more of just, we'll kind of see what this becomes. And now we've gotten so much information from different areas, social determinants of health, we've been able to mobilize now to actually try to create some more of that change. And now we're doing more advocacy when it comes to partnerships, but we've been sharing information with different organizations on feedback. So yeah, I mean, I think back then I wasn't there myself, but back then, at least from my understanding, it was just still more of that whole, we've kind of heard this pitch before, we really want to make sure that's something that changes. So we've been more thoughtful how we structure BeHeard because that's something that we've always experienced as a community when it comes to research.
Yeah, and tell me a little bit more about, the thoughtfulness then that you took from, or that the organization took from that experience in structuring the panel. Like, how has that impacted the way the panel's been structured?
Yeah, so in the surveys themselves, we have ability for you to be able to provide any feedback on topics you would like to hear, on things around politics, any kind of information you want to relay back when it comes to things at the community level to the politicians level as far as what you want to inform. So we use that. We try to make sure that when it comes to supporting Black-owned businesses, is something we hear a lot about as far as just that need to be able to support industry. When it comes to that, we source a lot of our incentives. And that's something that we were told was to actually start to buy more incentives that matter to them. There's a lot of people who offer surveys for local businesses that don't really apply to maybe the clientele or the consumer base's shopping habits. So through a whole thing with starting BeHeard that way, we got some information from community initially before BeHeard's infrastructure was set up, but it was built into so that we would start to build partnerships with different businesses so that we can start to buy products consistently from them to help promote their businesses and help actually fund Black-owned businesses locally, but also make sure that we can be able to have consistent products that matter to the clientele. So we had a market research company that actually helped us figure out through social media, through interviews with community members and different partners, what it is exactly that might be good incentives or things that will lower the barriers for people to participate. It's hard for a lot of us to feel trust to give a lot of personal information, especially with these surveys. They talk a lot about what's happening in the household.
Yeah.
I'm trying to think, what else from what I can think of.
Well, actually, before I'm sorry to interrupt, but since we're talking about this is the businesses, once you found out which businesses would be great to partner with, were the businesses enthusiastic about partnering with you all? I mean, has the relationship developed, beyond just them providing products for you to give incentives? Are they helping distribute the survey? Are they taking the surveys themselves?
Yeah, so originally from my understanding, when those partnerships were built, they definitely were enthusiastic about being able to provide that channel there. Of being able to actually have community members move to their dollars within the community. So that was something that automatically was a great business opportunity, and that was the proposition for them. It's something that we continue to try to build partnerships now. We do a lot of organizational partnerships for services, but when it comes to actual vendors, when we go out and do outreach events, we make a lot of networking opportunities, and we keep a log of all the different types of incentives, local artists, different people who make items or provide different services in the city. So we try to establish a lot of those business relationships. Right now, it's mainly just for the sake of just having that transactional relationship where we can buy a product or service and use that as an incentive. But something we have a community advisory board made of organizational partners, and a lot of them work with different community-based organizations and talk about how there's a lot of opportunities for us to have different innovative ways of promoting businesses, but also engaging business partners more. So creating opportunities at the point of sale, for example, might be a way to have businesses actually promote the survey. But that's something that we're actually working on now. We haven't gotten into that. There's some things that, as far as the BeHeard project, I'm the only one who manages it currently. So it's a small project. It's not too much of a high maintenance project, but it is something that when I pursue some of these other opportunities, it takes a little bit more time to get them set up. But that is something that we're looking at as far as being able to do that, for people to be able to sign up at the counter and even maybe maybe even provide opportunity to provide proof on their phone so that they can get a discount, so it can help maybe drive sales. So there's some different things we're looking at, but I know that we have to figure out the structure and the legality behind that. We get a lot of state and federal funding for programming, so that's something that we have to consider and look into, but that's an opportunity we want to expand on.
Right. Okay, awesome. Yeah, and I know, I'm sorry, I interrupted you in the middle of a thought, so around the former question.
Oh, no worries. No, I couldn't think of anything else. Nothing that popped out at least.
Okay, awesome. Right. So I know the BeHeard Maha, there's a panel, and it's made up of a diverse set of people. But what's the experience like of those panel members, and what sort of qualifications do you look for in those panel members?
Yes. So the experience. So initially, so the way the research works is that we do it through convenience sampling. So this is non-probability. So when it comes to doing different types of studies on the data we collect, we're kind of limited when it comes to being able to compare that to larger populations, because we are using opportunities such as outdoor events, health fairs, health clinic locations, family. A lot of it's during the summer and springtime, but we use a lot of those opportunities to do recruitment. So it's convenient. We go to a place, we get people to sign up, but essentially you just sign up, you complete a short 10-question enrollment survey, and that gets us our demographic information. So that's the first set of data points we collect. And it gets a contact information. We get contact information from you. We can either mail it, text it to you, or we can mail it, text it to you, or email it to you. It's a web-based survey. So other than the paper option, you need the internet to do it. But once you sign up, every month you'll get monthly alerts that a new survey is available. They're on different topics. They could be on transportation, involuntary displacement, or also known as gentrification. When we talk about cultural changes, when we talk about healthcare experiences, race and discrimination, there's a lot of different topics, education, when it comes to employment. So we send those out, you get those monthly topics, and every time you complete them, if you complete them, you actually get to have a chance to win those incentives. So a lot of times they're just gift cards. Sometimes we get items like gift baskets that were prepared by local vendors that we would we'd have people come in and pick up. But a lot of it's like gift cards, so it's easy for us to mail it to you, or send over the numbers to you if you like. But yeah, so once you sign up, we get that information. We get to understand all through the topics what kind of ideas you have around your your experience in community. So we know where you're reporting from, but we also know what is it that you're seeing, and we can use that to understand different areas of neighborhoods. And that's the beauty of BeHeard, is that we get that neighborhood level specificity that you don't see a lot of times when it comes, particularly to our community, but a lot of communities of color. When it comes to state and local surveys, they just don't collect that much money. Their outreach might just not be done in the right way. We do see a lot of opportunities that they have a lot of opportunities to connect with community partners like ourselves. So, and we have done that in the past. So we know that that's something that that we're able to kind of bridge, because that's the value we bring to it. Really it's mainly just to be able to get information, and then we can inform people of results. When it comes to like the next step of it, it's actually part of a current project, the BeHeard Colorado, but it's to engage people further up that ladder. So we want to get people to not just be informed or involved in providing feedback. We want to get them up to the point where they're actually collaborating with us and are also leading community initiatives. So it's that ability to build capacity within the community on issues that matter to them. This is a great way that it kind of builds off of that. And that experience is that you can really give your feedback, and we're hoping that that engagement part will really show more of that results, that you don't just complete surveys and get incentives, that you actually have opportunities to show up and get information on data that's been presented at a location in your neighborhood. We have opportunities to actually go and visit lawmakers. So that's something that we're looking to really move more into.
Awesome.
Qualifications, for qualifications is really, you really just have to be 18 years old. It's kind of arbitrary, but it's mainly the rationales that we can actually have an idea of the voting populace's opinion on these things. So we have some questions about children in the household, or if you're a parent, caregiver, or guardian. So we can still get some insight about what's in households, but we don't ask minors any questions, or we don't accept them onto the panel. And then you just have to live in Colorado, and that can be in any way. You don't have to be a resident. You just have to be someone that can talk about Colorado experiences consistently. If you want to, if you move out, then we can be able to remove you from the panel. But that's the only thing. It's just 18 years old, be here in Colorado. It's just an opportunity for us to really, and also, the eligibility that we mainly focus on the Denver metro area, but everybody in Colorado can apply. Race and ethnicity
Okay.
as well. There's no exclusion to that as well. Although we focus on understanding more about the Black and African American communities across Denver metro, because that's more of our scope as far as our services and influence. We want to actually expand it more to statewide practice. And to be able to help with serving different areas in Colorado when it comes to data sharing, collaboration, and just doing health advocacy.
Mm-hmm. Yeah, so I guess when I wrote this question, I kind of used the wrong word. I was thinking about the community advisory board, but also I'm glad I'm glad you interpreted it this way, because I did want to like learn more about how like the survey works. And also just to clarify, like when you say panel, you're like saying that, and I think this is really cool if this is right, that everyone who takes the survey is on this panel, like, right? Is that what it is? Oh, did I lose him?
Oh,
Eric, can you
sorry,
hear me?
can you hear? Oh, sorry, I'm back. Yeah, I can hear
Okay.
you now. Yeah, sorry.
Yeah. So
On my side.
when we say panel, that refers to everyone who takes the survey.
Yes, yeah, it's considered online panel, but yeah, that's just a name for all the people who said that, hey, I give consent for you to contact me, and they give that enrollment information, the demographics.
Okay. I think that's cool, like in a very subtle way, in that like when you hear panel, it can seem like, oh, like exclusionary, like elite, like this is like limited to like professionals, that these are people who know what they're talking about. But like the fact that everyone, like this is a community to have, like everyone is on this panel, everyone's voices matter. I think it's a great choice of word. I don't know if that was intentional or not, but I think it's actually quite beautiful.
Oh yeah, yeah. It helps to see in comparison how all the groups and community shows up in so many different ways. So that's the good thing, is that we're able to look at other people who don't identify in our community as someone who can provide valuable information too. They live in the same areas. We interact with each other in a lot of ways. We eat, work, play, pray. We go to school together. We have close family and friends in different areas, and so we're interconnected in a lot of ways, and that's the beautiful thing about community. So this is nice because we can be able to see really who else would be. But the only issue is that, we're not, of course, representative of the communities that we're sampling, too small of a size, and of course skewed that we have a lot more of the Black population enrollee. But that is intentional, of course.
Right. So now talking about the community advisory board, like who are these people? Where are you recruiting them from? And like, what are you looking for in advisory board members?
Yeah, so originally it was organizational partners. So we had like Colorado Department of Public Health and Environment. We have Colorado Health Institute, Colorado Health Foundation, Kaiser Permanente. We have, people across healthcare systems, but also do information, not just services. We have different groups such as the, Coalition for Disabilities. We have a few different ones around food and, how do I say, food share networks. So there's some ones, and it's kind of going from government to city to local counties, where we have some local health departments, and then also down to community level as far as organizations. But again, they all represent and have, particularly, of course, they're going to have some interest in that. And that's something that we want to kind of expand on, is that we don't have really the capacity to really develop a larger community or more intricate advisory board right now. I would love to actually involve more community members. I do some work on the side for another initiative that works directly with communities in 5 different neighborhoods. So all of it's community led, and everything's open to community. And that's something that I want to eventually do with the community advisory board, because they'll give us even more insight than the panel members will be able to. And then more consistent panels. So, that's something we like. But yeah, mainly it was just selection of current partners who could provide insight when it comes to survey methodology, when it came to what kind of issues are being voiced from communities that they're hearing about through their connections, when it comes to incentives and governance of the council. So there's a few things that, that we did. It's not as active as we would like it to be. It's, we have quite a few different people on there. So it's nice because they help give insight to a lot of the surveys that are originally crafted, the incentives as well. So they provide the impact at the beginning of the project. And it's something that I want to help with actually engaging as well, and having community members be able to be part of that as well. So yeah, that's something that we're trying to develop more and more now.
Yeah, awesome. So what kind of thinking about impacts? The findings that you're getting from the surveys, like what sort of impacts are they having in policy in the area, and sort of what sort of hopes do you have for impacts in the future?
Oh, okay, yeah. Yeah, so for impact. So, the BeHeard panel, it's always been set up to gather the voices of the community and to amplify that in those right areas. So, mainly it's been just on the community level, just informing partners of what's happening in different neighborhoods as far as what's being reported out. Again, they're so small, it's not representative, but it gives some insight and can even help give a little direction to organizations as far as the kind of questions they should be asking. So that's something that it started out as. We originally with the church communities, expanded out to other community-based organizations that provide health or well-being services. And then now we're doing a little bit more on local governance issues. So two main things. So two that we've done in the past. Oh, sorry, can you hear me still?
Yeah. Your picture froze up a little bit. I can hear you. Yeah.
Oh, okay, good. I saw you freeze too. Okay, great.
Yeah. Yeah.
Okay. Yes. And then so one that was a local one that we did about 2 years ago. And this was just before I came on board, but I was able to see the results of what was presented. Was that the RTD? There was an opportunity for RTD, so that's our regional transportation district. So they run our light rails, they run our buses here in the Denver metro area, along the Rocky Mountain here. So they actually had an opportunity for their board to consider creating lower fares for certain special populations. So looking at when we talk about youth, and then also when it comes to low-income families. So they were looking at creating an ability for them to actually be able to get lower fares, to be able to transport across the city. And there was a community-led campaign to help push for that initiative. So what happened was, as soon as we heard that that was occurring, that was an opportunity for something good for the community as far as the transportation benefit, we created a survey, launched it out in community, and got nearly 100 results back from community members regarding how they feel how they use the RTD system, how much they feel like it would benefit for them to have this measure in place, and any kind of other feedback they might have. And we were able to create a one-pager document that was distributed at the board meeting, and it was shared at the board meeting during testimonies. So it was an opportunity for us to take that and actually use it in a setting where they were advocating in lifetime to policymakers. Ultimately, in this case, the board did not go forward with actually approving that, but it was just an opportunity for us to respond to a community issue in a timely way and actually be able to have some kind of impact, hopefully, when it comes to advocating in that way of really tapping into community quickly to be able to deal with these responses. Policies shift so quickly, and a lot of times we don't hear enough about them to even act on it. So it was an opportunity, and it was nice to be able to use the platform for the first time to push something that was actually happening in community. The second one, which was a more recent development, and is definitely I'm very excited for. It's actually it was originally started for a 2 citywide initiative. So it's called the Healthy Kids Meal Initiative. We have 2 partners. We have the Children's Hospital in Aurora, Colorado, and the Denver chapter of the American Heart Association. Both of them reached out to us because they wanted to understand African Americans' opinions when it comes to having restaurants in both city of Denver and Aurora, have the restaurants change the kids meal menus to show on the side healthier drink options more prominently and initially, at first, before they would show any of the sugar sweet beverages. So that would be like water, milk, non-dairy alternatives over sugar juices, anything that's got added sugar in it. Because there's a lot of initiatives out of state in California. We have Lafayette, Colorado, a lot of places that change policy and are starting to see some benefit when it comes to people actually ordering less of those those drinks. The idea of not having soda in schools. Don't have the vending machines there, because it creates an opportunity for people to use those products. So they asked us to help create a survey, help disseminate it, do the analysis. So we did all of that. The good thing about the data was that we got to see insight from different wards within Aurora as far as what they believed around sugar sweet beverages, if it's healthy, what's their behaviors and practices with them and their families when they go out and dine. We looked at if they think that policy or law should have any impact on whether they have any impact on their their eating habits. There's a lot of different things that we looked at, but it was mainly just attitudes, perceptions, and also understanding that they had support for that ordinance. We had 170 people respond to that. They had used that to actually get it past the first round in the Aurora City Council. So they actually approved it for the first round. And the second round was supposed to actually start where they would meet and finalize the vote on it. But unfortunately, because of the COVID pandemic, that's been shifted. So we're hoping that that's something that that will gain support in the second round here, but that data helped support that when they testified during the City Council's first round. And then also they provided a lot of different information around to different city, to Aurora organizations and to restaurants. Something they're doing on the side is they're getting pledges from restaurants in Aurora around to voluntarily change this and to support the ordinance. And I believe they gotten over 70 restaurants to agree to that. And, they use the data to help support that. So that was something that, we're excited about. There's a lot of different things that we're hoping that we can start doing around this area of really supporting evidence-based ways of being able to promote and protect public health.
Yeah. So, I mean, along similar lines, in light of the COVID-19 pandemic, I know CAA developed a survey on COVID-19 recently, and obviously a lot of people around the country are realizing and looking that African Americans are being disproportionately affected by COVID-19 nationally. So, I mean, what sort of information are you hoping to learn and surface from the survey? What gaps are you hoping to fill? Are you seeing results already? Like, sort of where does it stand?
Yeah. So I guess some background on it. So yeah, we do have the community needs survey out. It's called just the COVID-19 community needs survey, but we have that out until May 28th. And the purpose of it is to want to understand the current impact of COVID-19 on the Black African American communities across the Denver metro area. We're doing more outreach mainly in that area through our partners. And then it's also to use that information to inform community and government organizations on the issues, the needs, behaviors, perceptions of community members in a few different areas. So we're looking at their concern or fear of infection, their employment status or impact, medical needs or any barriers, such as getting prescriptions, any financial issues that might be arising as far as income interruptions. Do they have trust in where they get their information around COVID? And we ask mainly around, a lot of things when we talk about alternative news sites, news sources online. We ask a lot about government sources and local TV and newspapers. We ask a lot of different sources that we're trying to really, and there's a lot of these questions are the same that the state recently ran with their survey, but because they got such a low response, we wanted to make sure that those questions were the right questions, but we wanted to make sure that we were asking from our side to make sure that we can share that information as well. So we asked a lot of the same questions they had around these, and we talked a lot about that concern for the future when it comes to the outcomes of all of this. The thing is that recent survey. I didn't mention that. So Colorado Colorado Department of Public Health and Environment. So they put out that survey around COVID back in late March, and they got 44,000 respondents, but it was only 0.9% identified as Black or African American. So less than 1% of respondents out of 44,000 participants on the survey. And this is something they have the results publicly available. That's where we got the questions. As far as that, we added a lot of other questions ourselves when it comes to understanding a little bit more about needs. And we have an opportunity in there that you can actually say that, hey, I would like to get follow-up from our center on navigation services. We've had a lot of people reach out to us already, but it's another way that we have people who take the survey actually be able to follow up. And we've had quite a few responses already. We launched the survey, it was just maybe a few days ago, and we've had over a dozen community responses already. It's another way that we can just get more feedback and understand from them. But yeah, it's just that the gap really is just having our voice be loud enough so that we can actually be able to give a lot of this emergency relief funding that's available to our community to help benefit us. And if we don't have data to support that, we don't have a lot of movement, unfortunately, in the current systems that we have in place here. So we're hoping that we'll be able to ask a lot of those same questions: is how are people feeling about this? What's impacting you, and what do you need? And I'll just help us learn a lot more about just, we're learning a lot more about community just through the survey itself, but we're learning a lot more about how quickly we can respond in our new reality. I feel like, when it comes to online or doing things virtually, it's going to be something that we're going to have to get a lot better at and more responsive when it comes to using the tools and technology. So this is great because this is something from an evaluator standpoint that I'm looking at of how can we make sure that we can perfect things like this to be very responsive to anything that comes out.
Yeah. And I mean, just a little topic on that, because I mean, that's something that I think about a lot too, because I work in, with similar communities, but mostly on sort of climate resilience and environmental health and that sort of thing. So how is that experience working out so well, shifting to a more digital, shifting, since, you relied a lot on these community events, on, places where you're giving people paper surveys or giving them information. How is that transition for you into this more digitally focused age?
Yeah, with outreach, it is more difficult because everybody has to find the best way to do the outreach to the audiences they serve. So when we're talking about communities that you serve, a lot of organizations could have a variety of different ways and tools that they can deploy for that. For us, it's been mainly just making sure that we're just, again, strengthening our networks. That's something that we've always prided ourselves on, but we wanted to make sure that in particular that this is something that we can use to support others when it comes to outreach. We do a lot of face-to-face when it comes to our daily work with communities. So, transitioning to a lot of us working remote at home or having very limited interaction out in community, we mainly just been able to just utilize a lot of the virtual teleconference tools. We've been utilizing a lot more of our communication channels within our own teams. So it makes it a lot easier. We spend a lot of time being able to just talk to each other in the office. So we've been able to try to find a better way to communicate more consistently with each other. We're going to doing more live Q&A webinars. We've done already 3 on Facebook Live. And we have recorded files that we're hoping to share on different sources like social media. We have 3 different accounts, Facebook, Twitter, and Instagram. It's really just us, trying to really utilize what we have now and then trying to implement anything new that might be useful. I'm always looking to see how we can use technology for evaluation. So I'm just trying to figure out how can we do it now that our setting is a little different when it comes to how people engage us. Rather than being in the room, we have different ways that we have to engage people online now. So it's just another way of just being flexible. But it's been going well. We've been sharing a lot of our strategies and what's been going, in our downfalls with other people and vice versa. So it's been a great experience, I think, for a lot of people in our field to really start to work and try to solve a lot of these gaps that we didn't realize we had to rely on until now that it's really anything we can rely on. So yeah, it's been very interesting, I gotta say, and a little fatigue. I think everybody's tired of conferences. Right.
So I guess my last question is, what other tips would you give to an organization who's trying to start a BeHeard program or this sort of, community engaged research type, network and program in their own community? What advice would you give them?
Yeah, I mean, if I had to summarize it in quick bulletins, it would be, decide what you hope to achieve by pursuing that. There's a lot of value in it, but you'll definitely need a dedicated team or at least a dedicated person to be able to maintain that. But, ask yourself the questions, what's the vision behind it? What's our methodology? So what's our steps on how to actually do this? What's our organization's capacity and resources to support this project? And you have to think sustainability, unless you're planning on doing time limited project. Definitely want to make sure that you have some funding that will take you past what you expect to be able to run past. If you don't want to do disservice to the community, you want to make sure it's something that has longevity, unless it is supposed to have an immediate outcome. For us, it's more of just looking at changes in the community over time. So ours is inherently going to be built to look at longitudinal change. So we have to be able to run and think about sustainability with our work. But that's something definitely consider. You don't want to necessarily have too short of a benefit to the community, especially if you have a good model. And, ask yourself, how can we be actionable and accountable for the work? After that, build a rapport with your audience and any potential recruits to the panel using your existing services, partnerships, create some new partnerships because those opportunities will help increase your ability to recruit and to retain people as well. Depending on how you are able to levy benefits, there might be a way you can communicate other organizational opportunities or benefits such as events that people can go to or giveaways, different services that are provided through your communication channel. So you can be a conduit to community to provide them information too. and keeping communication, and that kind of plays into keeping in communication with your panel members. You want to maintain integrity. So do what you say. If you're going to give an incentive award, do that. If you're going to follow up with information or anything in particular, make sure you do that, and you properly set everybody's expectations on that. That goes back into, we don't want to over research our community, and then they feel like they've been taken, for a fool because they trusted us and
Right.
that we said, or we misled them. So it can be tough because some, intentional or not, you can always do that where you can disappoint your audience with what they might even perceive as the benefits. So you want to be very clear with that, and keep everybody up to date and in the loop.
Yeah.
I guess finally, just like a pro tip, engaging the panel in activities. So, creating opportunities for them to grow their own skills, their knowledge, and, for them to practice while working on a community-based issue. And that's exactly with what we're trying to do with BeHeard Colorado, is to create that opportunity for that engagement. So pro tip is just not to just inform or to involve. So again, telling community what's happening and also getting feedback from them, but actually moving them further up where they can actually start to have more capability and ownership over the things in their community. So that's something that you definitely want to eventually, I think might be the ultimate goal for a lot of organizations, is not just to connect with their community, but to help to actually grow them. A lot of people use the power, but how that shows up, it's a quick way is to actually give the community the ability to tell you what it is that to them is empowering, and give them and help support them, rather than tell them what to do. We run into a lot of those issues where we're told what to do, and if you're not heard, you're very resistant to participate.
Yeah.
So it's something we want to make sure that community's involved, and eventually they lead.
Right. Oh wow, this is awesome. This is so great. The work that you're doing and CA is doing is just fantastic. Before we go, do you have any other questions for me about public agenda, about CBH?
Well, I was curious. I guess once the blogs publish, will you let me know? Because I would like to share.
Of course.
Yeah. Okay. Great.
Yeah. Of course.
Okay. Perfect. Do you know when it's supposed to be? Is it supposed to be in like June, July?
I'm not entirely sure. I know I'm going to be writing it in the next, like this week or next week. When it'll get published, I know we're supposed to do them around the time we do like the visits with the states. But like timelines have been thrown into chaos, obviously, with COVID. So under normal circumstances, this would have already been published, and then we've done another one in June. But I'm anticipating probably June is probably when all of them will get published in like batches or scheduled. Yeah.
Okay, cool. Nice. I'm excited to read the other grantees. That's cool. Okay, that's perfect. Thank you so much.
Yeah, absolutely. All right. So, of course, you have my email address. If anything else comes up, feel free to email me or Gloria. I may think of another question or two or something, so I may email you that. But you're giving me a lot to work with. This is great. And I'm excited to see where BeHeard Colorado goes moving forward.
Oh, that's perfect. Okay, thank you so much. I appreciate you. Yeah. Send anything over, and I'll try to just respond right away. Or you can always we can always chat again on the phone if you like.
Of course.
That's perfect.
All right, Eric. You enjoy the rest of your day.
All right.
Okay. Bye-bye.
All right. Take care. Bye. Sorry, froze.